Welcome to Rare Action Toolkit number 6, State versus Federal Government. In this toolkit, we're going to cover differences in the authorities and powers granted to the federal government versus the state government. A lot of what we're going to be covering in this toolkit has to do with the powers granted by the U.S. Constitution. So for those of you who don't remember your high school civics lessons, prepare for an overview of the Constitution and its different powers. So the U.S. Constitution divides power between states and the federal government in several different ways. First, there are enumerated powers. These are powers only held by the federal government, such as the power to make treaties or declare war. There are reserve powers. These are powers retained by the states. This typically means police powers, or powers to protect public health. There are concurrent powers. These are powers shared by the states and the federal government, such as the ability to tax. In addition, each state has its own constitution, but these are typically modeled after the U.S. Constitution. However, all state constitutions must also comply with the federal U.S. Constitution. In addition, all state governments are typically modeled after the federal government and consist of the same three branches: an executive, such as the governor or the president, the legislative, and judicial. This Venn diagram provides an overview of the different authorities that exist within under federal power or state power. For example, only the federal government has the authority to make treaties. Only the federal government has the authority to declare war. In addition, only the federal government can coin money, protect copyrights, and regulate commerce between the states. By contrast, the state has the authority to protect public health and safety, such as mandating vaccinations. States also have the authority to regulate commerce that exists entirely within their borders and does not affect other states. States can establish public schools, and states regulate professional licenses, such as those for doctors. In terms of power shared between states and federal government, both have the power to tax, both can establish a judiciary, and in addition, and obviously, both can make and enforce their own laws. So this differentiation between powers between the federal government and the states has a huge impact on public health and rare disease policy. Primarily, states and their localities retain a tremendous amount of responsibility and authority for regulating health. For example, states are often responsible for disease monitoring, including disease screening. States are the only ones responsible for food safety, such as restaurant inspections, or inspecting for environmental hazards. States are the only ones that can mandate vaccinations or declare quarantine and quarantine individuals because of health reasons. States are also responsible for the regulation of the medical profession, such as what it takes to become a doctor or a nurse within that state. In addition, states are primarily responsible for insurance regulation and the regulation of alcohol and tobacco. The federal government can use its spending power to incentivize the state governments to act, but they cannot always force the state to take an action that is not within the federal government's express authority granted by the Constitution. State government power and federal power is not absolute. There are very important limits and exceptions to their authority. For example, states can pass laws that go above and beyond federal law, but they cannot ignore federal law. In addition, neither states nor the federal government can enact laws that violate your constitutional rights, except in extreme circumstances. These exceptions generally occur when the public health and safety is at risk. For example, a policeman can enter your home during a fire without a warrant. A state can inspect a restaurant for poison or contamination of other products. And state public health agencies can quarantine highly infectious individuals that could spread dangerous diseases to others. The strong authority that states have to regulate health care, particular health insurance coverage, has an impact in terms of varying status of coverage between the states. For example, local political leadership often shapes the state's approach to public health, from issues ranging from Medicaid expansion to family planning, such as abortion, or to public health bans. Moreover, federal lawmakers have also given state insurance departments varying levels of oversight in terms of health insurance benefits, design, and rates. This slide is one example of what happens when you have so much different authorities that exist between states. So on this slide, orange states are ones that have very low limits of Medicaid eligibility in terms of financial eligibility, whereas blue states have expanded their Medicaid and have high limits of eligibility for Medicaid programs. What this means essentially is that Whether or not you have access to certain health coverage often depends on where you live. It is also important to note that there are huge differences between how the federal government and state governments deal with budgets and financing. For example, the state governments cannot run budget deficits, which means if a state wants to pay for a new program, they have to find budget offsets or new revenue to pay for it. Whereas if the federal government wants to fund a new program, they don't necessarily have to pay for it. They could just run a budget deficit and increase the national debt. So, what this means is that each state must work within their budget to fund programs and services most pertinent to the needs of their population. In addition, when there's a budget shortfall, such as during a recession, states must often cut services in order to keep basic functions of the government running. There are some key ways in how federal and state governments work together. For example, states often rely on federal government to help fund many healthcare services. However, federal funding is not free, and usually when the federal government is providing money to states, it is putting certain requirements on that money. In addition, the federal government does not always want to apply a single standard to everyone or in every state, so it often allows states flexibility in how to implement healthcare laws based on their needs. For example, some states may have a sicker population, some other states may have older citizens, etc. A great example of this dynamic is newborn screening. So the federal government provides funding for newborn screening to states, but does not mandate which diseases are included. Therefore, screening requirements often vary state to state and are determined by that state's individual public health department. These public health departments often face challenges in how to finance newborn screening systems because they have to find ways to pay for additional tests and equipment, skilled staff, and have more effective follow-up for families. So the federal funding helps with this, but it does not cover everything, and it becomes a huge challenge when states want to expand screening for diseases that there's not funding for from the federal government. Thank you for viewing this toolkit, and as always, to learn more and take action, visit rareaction.org and rarediseases.org.